Everyone, welcome to today's Echo session. My name is Francis Ochen. I'm from the African Society for Laboratory Medicine. Our session will run for about 55. We'll have interpretation services. Please keep to either English, French, or Portuguese. Do not share your personal information on the chat. We already have information that we require from each and every participant on the call. The session is supported and made possible given the funding support that we receive from the Bill and Melinda Gates Foundation. Today, we focus on unifying the private sector lab capacity to better support the national healthcare service delivery. We are aware that the private sector provides specifically in the lab space, but also generally in the healthcare space for a huge amount of service delivery in most of the countries in the low and middle income countries. But the non-deliberate piecing together of the otherwise huge potential in this sector limits the optimal contribution of the overall realization of the sector-wide goals, including universal health coverage. In Nigeria, however, a private sector arm of the Association of the Medical Lab Scientists of Nigeria, which is currently called the Guild of Medical Lab Directors, was established in 1998 to bring together all private sector players and coordinate their operations. And the Guild of the Med Lab Directors of Nigeria represents over 4,000 private labs, involving over 40,000 professionals across the country. And this formation works with the Medical Lab Science Council of Nigeria to support the regulation of laboratory practice in the private sector besides service delivery. So in today's session, we will introduce the Guild of Medical Lab Directors for Nigeria, its formation, its mandate, strategic partnership, and collaboration with the public sector to try and support the delivery of services in Nigeria. And to do this, we have a presenter, and our presenter is Prince Dr. Elo Kochu Adibo, who is the president of the Guild of Medical Lab Directors of Nigeria. Dr. Prince, let me hand it over to you to take us through the presentation. Thank you.
Thank you very much, Francis, for that beautiful background. I'm sure we can all see the heading of the presentation.
Yes.
The Guild of Medical Laboratory Directors, Nigeria, a vibrant private sector model for collaboration in Nigeria's healthcare system. Please, next slide, thank you. In Nigeria, medical laboratory sector is a critical pillar of healthcare, and we contribute significantly to the disease diagnosis, treatment, and public health interventions. The laboratory system in Nigeria is organized in alignment with the nation's healthcare delivery system, where we operate 3 levels: primary, secondary, and tertiary. Medical laboratory services in Nigeria are provided by both government and private sector, which includes NGOs, faith-based organizations, and other profit and non-profit organizations. There are about 40,523 medical lab scientists in Nigeria. Next slide, please. You can see this slide. Primary, secondary, and tertiary institutions provide various services to local governments.
Online. So let's take this one away from me. Talk with your mouth.
Okay. Thank you. You can see what is the guild. The GMLD stands for Guild of Medical Laboratory Directors. It's a private sector arm of the Association of Medical Lab Scientists of Nigeria. It was established in 1998 and has legal entity with board of trustees. Overall, we have over 4,000 members across the whole country, from east, west, north, and south. The purpose of establishment is one, to create opportunities for interaction, to ensure and reinforce the recognition of private medical laboratories, to identify and resolve problems facing private medical laboratories. We also gear to promote and maintain high professional and ethical standards in medical laboratory practice. We also stand to encourage collaboration, networking, business growth among medical laboratories. A typical example is what we are seeing here now. We're in our 26th National Scientific Conference, where you have various exhibitors, technical partners, and members interacting in one hall. You can see the membership spread around the country. Across the 6 geopolitical zones, membership and participation, you can see the spread, with the highest in the southwest, the lowest in the northeast. But the important thing is that they are spread across the country, and there's a consistent and valid advocacy to ensure that this spread continues to increase as we go on. Next slide, please. You must be a licensed medical lab scientist to be in the guild. You must have at least 5 years experience in private sector as a standalone lab, hospital-based lab, NGOs, and academia. Must also be a member of the Association of Medical Lab Scientists of Nigeria. There are prescribed fees and dues that we pay regularly in an annual basis. You must attend workshops, seminars, and conferences like the one we are attending right now. Typically, this is our organizational structure and governance structure, with the national president in the middle, with competent and well-selected, and of course, elected members of his cabinet, playing various roles from vice president to secretary general and other offices to coordinate the guild governance structure. This works very well and makes it seamless to manage the entire country where our membership spread. Next slide, please. So if you look at this slide, you see our formation and regulatory framework and collaboration. Our mission and vision and regulatory alignment is very clear. We are very well regulated for excellent practice by the Medical Laboratory Science Council of Nigeria. They provide an excellent framework for regulation. And of course, our mission is to improve diagnostic service through collaboration. And of course, we also ensure that collaboration with the Ministry of Health. We participate in National Laboratory Technical Working Group. We work in various committees, especially quality management system, sample transport, ethical conduct, and integration of disease processes. You can see snippets of the Medical Lab Science Council of Nigeria Act, and also a snippet of the Nigerian Medical Laboratory Strategic Plan. All these documents that are national have the guild embedded in them and the plans from private laboratory sector. Next slide, please. So we have very strong regulatory compliance, like I said, and our members are working assiduously towards accreditation. As of today, using the baseline check, ISO 15189 standard, we have about 12 of our laboratories accredited to international ISO 15189 standard. So many others are at one stage of accreditation process or the other. With good mentorship from our members who have attained various levels of competence in assessment and in accreditation as assessors. So they help to mentor the rest to come to speed. It's important to know that these accredited labs are skewed more to private sector than public sector in Nigeria. So in the whole of the country, 60% of accredited labs are private. The professional guidelines we have are very strict because we emphasize on accuracy, integrity, confidentiality, and very, very accurate test results. These guidelines encourage transparency and accountability. Next slide, please. So it's important to know that in quality, we emphasize on quality assurance programs organized from CPDs at the local chapters, regional chapters, and at the international level, sorry, national level. There is continuation of training of our members of the guild at all levels. And this also promotes ethical behaviors and education. For instance, the conference we are attending now is annual and has over 400 registrants from across the country, interacting with members from the technical groups, academia, regulators, and also exhibitors from all parts of the world. We ensure that we maintain we protect conflict of interest, that under no circumstance do we influence our test results by our interaction with different bodies that we partner with. The policies that are in place are critical in maintaining trust and objectivity in the service that we provide. Next slide. The Medical Lab Science Council of Nigeria have a standard for ethical conduct. And internally in the guild, our ethical committee aligns with this standard to ensure that our ethics are upheld in all our practices by our members all over the country. By these methods, the private labs maintain high level of ethical standards. And this is what ensures trust and quality in what we give out to our Nigerian public. Next slide, please. You can see our strategic partnership and impact on national health. The strategic partnership involves public health programs like the tuberculosis program, HIV program, malaria program, recently non-communicable diseases. In the public-private partnership mix in Nigeria, the guilds that test, the guild lab that tests tuberculosis through NAAT, nucleic amplification testing platform of gene experts, we have contributed to the 26% of the ppm in the national data of TB program. This is massive because it grew from less than 10% to 26% in 3 to 4 years. In Nigeria, it is not contradicted that over 70% of Nigerians access healthcare from the private sector. So our roles and contributions are huge. And of course, it has massive impact on national health outcome. Next slide, please. So you can see what I had already told you. From 2018 till date, about 20 labs are now offering TB testing through gene experts. The tests are free because the background, it comes from the program, ensuring that there's provision of machine, reagents, supervision, there's supervision of our tests are done from the national program. Then there are some incentives to support human resources and energy costs to ensure that these tests are available to Nigerians. This has been of huge impact to Nigerian fight to eliminate TB. We have also won in other programs like HIV program, increased testing for HIV has also been done by our individual laboratories. It's important to know that USAID, global funds, and other funding agencies support the TB program to bring about this free testing. And of course, the guild becomes some kind of pipeline through which this service gets to the Nigerian public. Next slide, please. It's also important to know that the success story in TB program comes from the fact that there's an excellent data management. Test data are uploaded to the portal of National TB Program, and there's also tracking of results and challenges encountered during testing. All the information from testing and results obtained are used for data and policy decisions. We attend and present our data at the annual review meeting of the TB program, and we contribute in discussions in improving TB management. This has yielded so much positive impact for the program and to the benefit of Nigerians. So the success story continues here. Over 300 GMLD labs do follow-up care for TB from the microscopy. Our labs with trained microscopists follow up diagnosed TB cases. This has been very, very impactful as well. Our key success factors are embedded in the PPP, that's a public-private partnership. GMLD partners with IHVN, Institute of Human Virology, to provide this. I already talked about incentives. And of course, Nigeria is speaking integration most recently, where all the processes and disease program areas come together to share platforms, human resources, and everything available to ensure that Nigerians are served properly. Huge data are generated for national planning and development. We are very proud to see this model replicated in other African countries, because there's a huge impact on public health like we've had in Nigeria. So we're looking forward that with this engagement with SLM and more meetings and presentations to come after today, all African countries can have a learning curve and can receive details from us, and even come over to mentor others to see how we can have this done in other African countries. Next slide, please. So it's important that private sector networks should unify laboratories under one association that will represent the interests of that sector while promoting professional ethics and compliance with national regulations. We are very strict with regulation, because that is the only assurance of repetitive, standard, and excellent service delivery. The public-private partnership initiative is huge. Structures of collaborations between private laboratories and public health initiatives help in disease surveillance and diagnostic expansion throughout Nigeria. Next slide. I will emphasize our alignment with regulatory bodies, because this ensures that we operate within the right framework and quality and reliable results of diagnostic services are provided. It's important to also know that we build capacity and promote quality. I am a director of ISO 15189 accredited laboratory. So are a number of my colleagues who are seated right here in this conference, and many more that are moving towards accreditation. So we invested a lot in continuous professional development, and we are sure that most of our laboratories shall continually deliver safe and high quality service to Nigerians. This is our pride, and this is what we want to replicate across Africa. Private sector strength is obvious and it's impactful. And in conclusion, the GMLD model has demonstrated that private sector laboratories can be indispensable partners in national healthcare delivery by fostering collaboration with government and regulatory bodies. Guild of Medical Lab Directors of Nigeria, the medical laboratory private sector in Nigeria, has helped to improve the quality and reach of diagnostic service across Nigeria. This model, anchored in strong regulatory alignment and quality assurance, offers a blueprint for other African nations to enhance their private health sector's contribution to public sector and health of the country in general. Replicating this system can lead to improved diagnostic capacity, of course, better health outcomes, and stronger healthcare system throughout the continent of Africa. Thank you very much for listening. Over.
Great insights from Nigeria there. Thank you very much, Dr. Prince Adibo Elo, and I know you will allow me use the shorter version of the name, Elo. Huge impact, really demonstrated, given the examples for TB, a work that the private sector is doing in collaboration with the public sector and the government of Nigeria. Of course, coordination and partnership with professional associations and the regulatory bodies is key with this formation that is bringing together a huge number of laboratories and professionals that are involved in the private sector work. Very exciting work from Nigeria being shared here. We will get to the questions shortly, but we would like to give one opportunity to Elom Emeka to just give some quick comments based on this. Elom Emeka is the Director Laboratory Services in the Federal Ministry of Health in Nigeria. And Fitsam, you will give him the rights to unmute, but Elom will come in shortly. Maybe I'll just give Adibo one quick question as you prepare Elom to make his comments. And we'll start with the first things first, Dr. Elo. The first is that how did we start with the Guild of the Medical Lab Directors? Was this a drive that was started by directors themselves, or this was a drive that was pushed for by the federal government of Nigeria so that then the private sector lab would be unified and then contribute to supporting the delivery of lab services in a very coordinated way in Nigeria? So how did it all start?
Thank you very much, Francis. The Guild started by the coming together of private medical laboratory practitioners from across the country to bring their interests together and set a platform through which they can be heard and they can also hear each other. And then they put together framework of constitution, laying down membership categories, membership criteria, objectives, mission and vision statements. We are happy to avail the SLM, our constitution, which gives all these details. The SLM Academy can have this, and you see details of how this happened. But it was not a government-influenced formation. It was really by the members who had common interests from across the country. And that is why our membership is across the country, from east to west to north to south.
Thank you. Thank you very much. Thank you very much. FitSam kindly deal with assigning Emeka along some co-hosting rights so that at some point he will come in and make a comment. So Elo, let me get back to you again on the question of current coverage. So from the presentation, we know that you're allowing some labs. I think from now it is about 4,000 labs that are in your membership, but also with about 40,000 professionals involved. Kindly just put it to context for the colleagues who are on the call. What proportion of the private sector is represented by this formation, by your formation here?
Thank you. Considering the over 40,000 registered registered medical lab scientists in Nigeria, we have clearly in our register about 4,000 guild directors. Now, this does not include other private practicing medical lab scientists. A number of us have in our employ medical lab scientists out of these 40,000. So if you put them behind the 4,000 directors, clearly you have over 60% of the entire 40,000 in the private sector space. That is the picture. Thank you, Francis.
Thank you very much, Elo. So let me bring in my good friend, Elo Emeka. Elo, yes, to just make some quick comments based on the partnership that you're having, the very, very productive partnership that you're having with the the Guild of Medical Lab Directors of Nigeria before we take additional questions. Over to you, Mr. Elo.
Yes, thank you, the ASLM team. The ASLM stand as the light for Africa, projecting the work that is happening in laboratory space, research, innovations, and beyond. For us in Nigeria, talking from the level of Federal Ministry of Health and Social Welfare, we have opened the network, encouraging stakeholders to be part of what we are doing. From the level of policy development, review, implementations. So across board, there's a network that is functional at all levels in Nigeria. And that is made possible by the present administration, made possible by the previous administration. And most importantly, as you know, the current administration, the Federal Ministry of Health, under the leadership of Professor Muhammad Ali Pate, CON, has a 4-point agenda, and that embraces all that is happening. The Guild of Medical Laboratory Directors in Nigeria. Currently, they are doing their annual conference. This team work together with the government at all levels, federal, state, and local government. And as you know, a lot of contribution from the private sector has contributed greatly to the success stories we have in Nigeria. And that is what we are showcasing today through the president of the Guild of Medical Laboratory Directors, Prince Elochukwu Adibu. As you can see from the presentation, a lot of things have happened around engagement collaboration. So when you look at our guideline at the Apex Ministry of Health, you will see full representation of key stakeholders, and this is what we're encouraging the world to do. While we embrace integration, research, and others, it means we need to look beyond the public sector, which contributions are also coming up and happening across board in the private sector. And this is a success story we are celebrating. This does not mean there are no gaps or challenges, but we are going to showcase this in the next few months. SLM, we are going to give you invitation or formally through the office of the Honorable Coordinating Minister of Health and Social Welfare in Nigeria, because Nigeria want to organize what we call National Summit on Diagnosis. We want to open up the discussion beyond the laboratory. It's going to be laboratory, clinicals, connectivity solutions, among others. This is going to happen in the next few months. All is to showcase what is happening both in the public and the private sector. And it's all about coordination and engagement. And this will support what we call integration in practical terms. Also, to inform us, Nigeria, through the Honorable Minister of Health, have also provided a guideline on integration for laboratory system. And that is also part of a celebration. And it's all done together with both the public and private sector. Guild of Medical Laboratory Directors were also part of this. Thank you.
Thank you. Thank you very much, Mr. Elom Emeka. They are the Director of Lab Services in Nigeria. And colleagues will go on to take more questions, and I will start with one that Abraham and a few other colleagues have brought up, and that relates to data sharing. And Dr. Adibo, you indicated that about 20% of TB testing is actually happening in the private sector, which is a huge contribution. And of course, it's not only TB, every other test that we do in the lab, in the public sector, I guess is happening in the private sector. Now, kindly share with us how you're sharing data from the private sector with the public sector so that the national data is complete. And kindly also let us know if it's only the TB data that you're getting some support from the ministry and partners, if it's only that data that is going, or data for all the tests that is happening in the private sector is actually making its way to the central database of the Ministry of Health.
Okay, thank you very much, Francis. The Federal Ministry of Health is very interested in organized data from every sector in Nigeria. From the TB program, from the testing platform, we have what we call GX Alert that automatically picks up data from the machine, GeneXpert machine, to a central platform with accessibility only to those that will use the data clinically and the MIE unit of the Federal Ministry of Health and TB program. Recently, the ELIMS, there have been boot camps for the Federal Ministry of Health to link laboratory information management system from both private and public laboratories into a central LIMS, and to link up LIMS from program areas, TB, HIV, malaria, to a central LIMS. These are ongoing. Data from non-communicable diseases are still being prepared for integration into these LIMS. But from HIV, from TB, and to some extent from malaria, are uploaded into this central portal that is accessed by the disease program areas and the Federal Ministry of Health. As we speak, it is headed by Elomemeka that just spoke to us a while ago. The system is organized and data protection is very much ensured through this system. Thank you.
Thank you very much. And I know you have colleagues with you there, and if you want them to support you in responding to some of the questions, please feel very free to do that. I think the next question is going to be on your relationship with the Professional Association of Nigeria. And I know that the General Professional Association of Nigeria is that overarching body that brings in all professionals, both from the private sector and the public sector. And you've actually indicated here that you have all your members are registered members of the Professional Association in Nigeria. Kindly throw some additional light on how this is happening, especially for the employees that you are taking up as private labs. Is there some obligation on the side of the proprietors of private labs to mandatorily also get their staff joining the membership of the professional association? And do you as employers make some contribution for their annual licensing or the first-time registration?
Thank you very much, Francis. Our professional association in Nigeria for the medical lab scientists is the Association of Medical Lab Scientists of Nigeria. It's like the mother association. We are affiliated to them, and we also have an organized incorporation with the Corporate Affairs Commission of Nigeria. We have an organized board of trustees and membership. The mother association is very organized with board of trustees, board of fellows, and very good structure. We wear two caps. One cap as GMLD, second cap as AMLSCN. None contradicts each other. Our members in our individual labs also belong to both AMLSCN and GMLD. In this conference, for instance, all of us wear two caps and none contradicts each other. We look out for the private sector part, whereas the entire AMLSCN has public sector members, NGO members, academia, IVD, and all. So it's generally one excellent group of professionals, medical professionals, medical lab scientists, trained and licensed by a recognized regulatory body in Nigeria. There are no conflicts. Rather, we strengthen each other and look out for each other. Thank you very much.
Great. Thank you very much there. Now I'll push it to, I know that you've spoken to your alignment with the quality management systems, and most of the private sector labs are actually working towards accreditation, or at least implementing general quality management systems to ascertain the validity of test results and the safety of the people who actually work in those private labs. We have one question that is coming in from a colleague, and he's asking your alignment with other requirements, because the ministry from the public sector may have requirements, especially for infrastructure. In most places we've seen in the private sector, the infrastructure for labs is really wanting, and it compromises not only quality, but the safety of both the workers therein, and also the people who come and seek services from those private labs. So with regard to requirements for infrastructure, are you also aligning the requirements for the building requirements, for example, from with those of the public sector? The public sector might have some guidelines. Are you guys in the private sector using the same guidelines, so that then the infrastructure for delivering lab services is adequate, safe, and can conform to those requirements?
Thank you very much. This is a very important question. If you heard when I mentioned that there are more private labs that are accredited to 15189 than public labs in Nigeria. So that tells you that there is a strong regulatory framework. The Medical Lab Science Council of Nigeria has established standard minimum requirements for setting up a private lab. It is strictly adhered to before you can be given private medical lab number, a serial number that is maintained and renewed annually by a regulatory body. They also come for inspection periodically to ensure that each of these are members here conform to the minimum standard of setup. So you don't just wake up and set up a lab. No. Within ourselves and our structure in GMLD, we also have internal mechanism for checking those that are practicing outside the scope. Those that are also mimicking what we do. That is to say, wax. We have zero tolerance for them. And our regulatory body liaises with us to ensure this does not happen. Recently, there's a ministerial committee on inspection of medical labs, and they are mandated to check private labs, public labs, tertiary, secondary. And of course, the guild are represented in this particular ministerial committee because we are very key stakeholders. So we are very well regulated, and our standards for establishment are laid down by the regulatory body, who equally regulates and measures standards for the public medical laboratories in Nigeria. And our practice is built on QMS, bedrock of the 12 quality essentials. Thank you very much.
Thank you very much. And just pushing it on a little on the QMS corner, I think we have had a few questions coming in related to the accreditation body that you're using for the private sector labs in Nigeria. So kindly just highlight, I know that Jean is doing a great job dealing with some of the questions in the chat, and thank you very much for doing that. But again, just it keeps coming. So which accreditation bodies are you using to support accreditation work for private labs in Nigeria? And again, I have to just disclaim that even when the accreditation body is a local-based, a national accreditation body, the requirements of ISO are the same, and every lab should just be meeting the same requirements. But just from you, kindly let us know which accreditation bodies are you currently using to support accreditation of labs in Nigeria, especially in the private sector?
Okay, hello?
Yes,
Francis,
we can hear you. Yes.
I would like to give an opportunity at this point to give 2 minutes to the National Secretary General of this association to give a word to the listening public on the activities of Guild. So he will do that after noting that in Nigeria, we have 2 accreditation bodies: Medical Lab Science Council of Nigeria Accreditation Service and the Nigerian National Accreditation Service, NINAS. It's also important to know that yours truly and yours humbly, leading the Guild, in my practice, I have the 2 accreditations. As an example, that is our standard. So for many of our colleagues who are going for accreditation, we go for the highest standard. And of course, you know, we are now in 2022. Those that are accredited to 2012 are having complete transformation to the 2022. You know, ensuring that all the components of 2022 are in practice in our labs. So that's it about the accreditation for our labs.
Thank you very much. Let's hand it over to the Secretary General to just quickly give us his remarks in 1 minute.
Okay, so NSG, give your remarks to the SLM and all the body that are listening. Thank you.
Francis, just hold it as a mic.
Okay. Thank you very much, Francis, for this opportunity. And our members are very happy with what we have showcased this afternoon. And we are really very grateful. And we hope with what has been said, we have better information about Guild of Medical Laboratory Directors. I just want to chip in a little that ours is a very regulated association, but not over-regulated. Because when you hear most of the things we are talking about, you know, you might be tempted to think that there's a measure of over-regulation. But with what is on ground, what we are aiming for all the time, consistently, is about quality of the result that we turn out to our members, reproducibility of results, and the integrity of the results that we turn out. So that at the end of the day, whatever results that we generate from one part of the country can be compared to another part of the country, and of course, is comparable to any part of the world. And these are the things that we are striving for on a daily basis. There are ways of improvement, and that is why we showcase this conference and this workshop on an annual basis so that we can learn, we can unlearn and relearn. And then when we go back to our facilities, we can step down these trainings for all our medical laboratory scientists who could not be part of this. And this is what we do on a yearly basis. And also, every now and then, we have a regulatory body and some NGOs that set up some of this workshop so that we can be better informed and conform with international best practice. Thank you very much.
Excellent, excellent. From the Nigeria team there, one of the few countries on the continent with their standalone regulatory council for labs. I think most countries, the lab is still regulated as a component part of an amalgamated council. But for Nigeria, a strong standalone council. Now we have a strong standalone private sector organization that unifies the work that the private sector is doing to contribute to the ultimate goal of the health sector program of Nigeria. Very exciting there, but we have reached the top of the hour, and I will give my good friend, Dr. Adibo, just 30 seconds to give us your closing remarks as we come towards the end of today's session.
Thank you very much, Francis. I would like to thank the SLM Academy and LSM as a whole for their intentional activities in Africa. We are proud in Nigeria to be part of this family, and we are looking forward to replicating the good platforms and the good learning curves that we have gone through in Nigeria to other Africans, to have overall an Africa that can boast of quality, repetitive, and excellent delivery of medical laboratory services. And of course, this will align with the world desire. WHO and all the world bodies desire to have an excellent healthcare delivery, which is a right of every citizen of Nigeria, Africa, and the entire world. So we hope to take this to another level and continue to engage and make this benefit very impactful to Nigerians and the whole of Africans. Thank you very much.
Thank you. Thank you very much. An excellent summary there from our senior colleague, Dr. Prince Elochoku Adibo from Nigeria, the president of the Nigeria Lab Medical Directors Guild. And so, colleagues, we've come to the end of our session today. Thank you again for being part of this, and hopefully you got a thing or two that you can learn from and support the unification of the private sector labs in your country and coordinate their support to the national health program in your countries. With those, keep on the lookout for our next session, and we wish you the best of your afternoon, evening, or morning, depending on where you're joining us from. Thank you very much.